Hello, everyone. Hello. I'm Warda Ali, one of the SHOs currently working in acute medicine department. And I would like to welcome you all to the listening event. These are the series of podcasts that we do to bridge the gap between the consultants and the resident doctors. And today's topic is the experiences of international medical graduates. I have with me Dr. Nalla, who is a consultant in acute medicine.
Hello.
I have Dr. Suman Singh, who is an F2 and a British medical graduate.
Hello.
And I have Dr. Abdel-Motaleb Moukalled, who is a GPST2.
Hello.
Hi, welcome once again. I would like to start this podcast by asking you, Dr. Nalla, what inspired you to come to the UK?
Yeah, interesting question. I was inspired by my clinical supervisor in India. He was trained in UK, returned back to India, and he shared his first-hand experience of doing the respiratory training program and also the opportunities for research he had in UK. That motivated me to come and get trained in UK. My initial thoughts were I would go back to India, but the work-life balance meant that I chose to stay.
What about you, Abdel-Motaleb?
So I graduated from a UK-affiliated medical school in Cyprus, and thus because of that our natural progression after our degree is to come here for foundation training and any further training that comes after that.
Yeah. And what are the biggest challenges, Abdel-Motaleb, that you feel you've faced?
So at work I would say the biggest challenges I faced were understanding the structure of the NHS. It's a bit different from what I was used to back in Cyprus. Second bit was understanding how to communicate effectively and what works and doesn't work in terms of communication. I'm not talking about language, it's more of who to contact, when to contact this person, what can you contact for. And then the last bit would be just managing the portfolio because it was brand new to me.
Oh yeah, I think I agree with that. I relate to this because not just the portfolio itself, there were a lot of things which were new to me. What is a pathway 2, pathway 3, what's fast track, for example. But yes, portfolio as well, because it was absolutely new to me.
Yeah, I had the same thing with the portfolio. So even though I was educated here, I've never seen it before in medical school. So I had to rely on my seniors to show me what the general layout was, how to fill it in, how to submit assessments to be signed off, which was really helpful. But had they not been there, I don't know how I would have managed.
That's insightful that even as a British medical graduate, you felt it was a bit challenging, isn't it? Also, Suman, I want to know, did you feel that the IMGs were treated differently in your experience, be it positive or negative?
Yes, so there is one example that comes to mind, and it happened during my psychiatric rotation. So we would do ward reviews where the consultant would talk to the patient, ask them about their symptoms, their medications, any side effects they're experiencing, and we would have to scribe it all whilst also doing a mental health assessment on them. And so for one particular IMG, I think there might have been a bit of a language barrier in that his level of English wasn't maybe enough to keep up with the pace of the conversation and to assess the patient at the same time. And so other colleagues ended up having to take on a bit more of his workload. So I guess it could be interpreted as slightly negative. However, I feel that in such situations we should really show a bit more understanding and a bit more patience because it's going to be harder for some individuals naturally.
Yeah, that's true. That's true indeed. What about you, Dr. Nalla? Can you find it relatable to have these challenges as an international graduate?
Yeah, my experience is similar to what have been described earlier on. I could see that there are similar set of experiences by IMGs when they start, mainly on the lines of getting to work in the new system in a new country, and having challenges with the communication, then a lack of induction and the career choice and progression. But what I've seen is over time, the LED program or the International Medical Graduate Support has evolved over time. You have bespoke induction program. There is a lot of information about the support you have. And also you have the shadowing period where you have time to settle down in the system. this was not available when I was making my journey as a SHO, or what we now call as resident doctors.
I can't imagine, because I felt it was very useful and helpful to have not even the shadowing period, but also the induction, definitely. Let's just talk a bit more outside of work, shall we? Let's just talk a bit about the challenges of social life, for example. I'll start with you, Abdel-Motaleb. What is the biggest challenge that you faced outside of work?
First and foremost is the weather and how cold it is here all the time. Second, I would say it's getting all your personal admin bits sorted, especially in the first 2 weeks while managing everything at once. Mainly getting a place to rent and basically getting an address that you can register for any bank accounts or anything that comes after that as well.
That's true. It's a bit of a culture shock, isn't it? I remember that I had to call my landlord complaining that the door cannot be locked. And when he came, he just showed it to me that I had to put the latch upwards in order to lock it. So yeah, it's a bit embarrassing, but it's like things you learn along the way.
I think I have something a bit more embarrassing than that.
Go for it.
So in my first week here, I had to take the bus basically to get to hospital. And in my country, the public transport system is not that good, so nobody uses it. I had no clue you had to wave down a bus for it to stop at the bus stop. So I was stood at the bus stop for like an hour and a half, seeing the buses go by one by one by one and be sadder with everyone.
Oh, bless you. Okay, I would also want to know some insight from you, Suman. And my question to you is, what sort of matters do IMGs come to you with?
I think similar things that anybody would ask when moving to a new area. So which part is safer to live in? Are there any nice restaurants? What things can I do for fun whilst I'm here? But beyond that, I think it's trying to rebuild that support network that perhaps they left behind at home. So maybe they don't have family or friends in the UK. So having people to talk to either about stressful work events or things that they need help with in daily life, I think that makes the most difference to build those relationships.
Yeah, I do agree with what Suman has said. Making my journey as well, I felt having that support from the friends was the biggest asset. And they are the ones who helped me to settle down in the workplace and also guided me to settle down in the social environment as well.
I cannot agree more with that. I think when somebody leaves their home and their family to settle to a new country, your colleagues, your friends, they are your new family. So it's very important that you have that social circle, that support system around you. I would now move to the conclusion and the final thoughts section of our podcast. And I would want to ask you, Dr. Nalla, how do you think that IMGs should prepare themselves, and what would be the advice that would make their experience easier?
I would suggest to get to know about the UK system before you make that journey, so that helps you.
Yeah, I completely agree with that, getting to know what you're stepping into. And also, I think inductions play a good part in that as well, because they give you a lot of framework of what you're going to go through later on.
And I think as well, it's important to ask for help, but it's also important to recognise when people around you need help. So in particular, if you know you have colleagues who are new to the country, new to the hospital, take some time out your day, show them how to order bloods or scans on the system, show them where equipment is for clinical skills, show them around the hospital a bit, where the canteen is for hot food, where the mess is to get some rest or play some games with friends, where the Costa and Co-op are to get hot drinks and snacks, which keep you running throughout the day.
Oh, definitely. Yeah, that is so true, especially the Costa and the coffee bar.
Yes.
I would like to thank all of you once again that you took out time to share your experiences, your workplace and social challenges. And it was very insightful. So thanks a lot, guys. Thank you.
Thank you very
Thank you.
much.
Thank you.